I absolutely loved my rotations in the labor and delivery and mom-baby unit at UC Health this past week. I'm proud of several strengths that I demonstrated during this time. One of which is that I know when it's appropriate to ask questions and when it's best to just observe. In general, I'm an extremely curious person, and in my previous rotations, noticed that I'd occasionally ask questions at inopportune times. I recognized this at my last rotation, and I'm proud to say I feel like I improved. For example, when I had questions about concerning findings on the fetal heart monitor, I waited to ask my preceptor until we were back at the nurse's station. In another example, I had questions about the medications my preceptor was providing, but I noticed our patient was having a contraction, so I held my question, joined in silence until her contraction passed, and brought the patient emesis bags and towels till she felt better. This approach helped my clinical experience because I was able to both ask questions and contribute more to patient care. Another strength is that I speak with confidence and respect to all members of the clinical team. I was proud of myself for advocating for my learning and jumping at opportunities to ask questions when possible. I was told my apparent eagerness was clear to other people on the team, and as a result, I was able to learn from providers throughout the unit. For example, when in the OR on the labor and delivery floor, I had an opportunity to talk to an attending OBGYN. I asked her questions about the C-section and her role in general. And while in a patient's room, I was introduced to the anesthesia resident, who took the time to walk me through how we inserted an epidural and provided alternative analgesic options for people in labor. While in the mom-baby unit, I asked one of the visiting nurse practitioners if I could observe a circumcision, and from that experience, I learned about the various techniques to performing a circumcision. I also got a chat with several of the advanced care partners on the floor and expressed interest in applying for the role when in nursing school. My preceptor overheard and introduced me to the manager on the floor, and I was able to share my information when the position opens up in a few weeks. One other strength I demonstrated was that I communicated clearly and directly with patients and their families. In my previous rotations, I noticed I was very nervous to speak to patients directly, worried that I was going to be asked a question I didn't know the answer to or seem incompetent or in the way. But I made a conscious effort to improve this in my OB rotation, and I think I did well. I let my preceptors know this was a goal of mine, and they helped me find appropriate opportunities to converse with patients and provide care independently. While in the L&D PACU, my preceptor had me take vitals and perform fundal checks on our patients every 15 minutes while she observed. In this time, I'd chat with the patients, ask them about their pain, and see if there's anything else I could provide for them or their family. This repetition really bolstered my confidence in patient interactions and helped me excel further in my patient interactions throughout OB. While in the mom-baby unit, my preceptor let me practice patient care from start to finish after entering a patient's room. I think I did a great job introducing myself to the patient, explaining what their meds were for and what we were providing them, and answering any questions or concerns they have. Of course, I did have some areas of growth, though, and one of these weaknesses was my confidence in supporting a laboring person. Despite having been present at over 10 births before this rotation, I realized I'd never been actually present for the first stage of labor. I noticed I felt a little awkward and helpless when caring for these patients and had trouble predicting what they would need before, during, and after their contractions. I also felt uncomfortable approaching the patient and providing comfort measures, even though I know this knowledge. I'm actually a trained doula, but I've yet to support any patients, so since this rotation, I've signed up as a volunteer doula at Denver Health and hoping this will help. Another area of weakness was my organization of the nurse brain and anticipation of necessary nursing tasks. One of the more confusing experiences while on this rotation was change of shift. I really had a hard time following conversation when another nurse was sharing information at the beginning of the shift with my preceptor. I tried using the nurse brain they gave me, but I probably only picked up about 60% of the information. Consequently, I felt like I wasn't always really clear about what our tasks were for each patient and how to prioritize those tasks among all the patients. This was my first time using a nurse brain, so I think it's going to just take time to learn, but once I'm placed on my immersion, I think it'll also be helpful to edit a nurse brain to work for my brain. I also had a hard time navigating between the tasks on the brain and what's listed in Epic. I'm assuming they're the same, but I found it confusing to navigate between the two. With that said, I've identified two SMART goals. One, to tackle the weakness of confidence in supporting laboring persons, is that I'm going to complete 12 12-hour shifts as a volunteer doula at Denver Health between December 31st, 2022. To make sure I achieve this goal, I'm going to ensure that my application as a volunteer doula is submitted and that I meet my minimum volunteer requirements, which is 144 hours by the end of the year. To tackle my other weakness of organization of my nurse brain and anticipation of necessary nursing tasks, my goal is that I will fill out 100% of my nurse brain within 1 hour of beginning each clinical shift from May 25th to December 15th, 2022. To make sure I achieve this goal, when my preceptor is available, I'll ask to sit down with them, review the nurse brain, and complete any elements I missed during our handoff report. Although I plan on pursuing a career as a labor and delivery nurse, the skills I learned during this rotation are going to be helpful in any area of nursing. As a nurse, I'll always have to be cognizant of the needs of not only my patients, but their support people as well. And I'm sure this is going to be really relevant to the work in pediatrics at my next rotation. I also learned to speak with confidence and respect to all members of the clinical team. And again, this is relevant to all areas of nursing. Nurses need to communicate clearly and professionally with doctors, pharmacists, care coordinators, and other people to advocate for their patients' needs. And although I still have a lot of area to improve within this regard, I also learned how to better support a patient experiencing acute pain. While labor is obviously unique to obstetrics, nurses have to care for patients experiencing acute pain in all patient populations. I think many of the strategies I learned to care for a laboring person also apply to patients with pain in general. For example, a nurse can provide comfort care such as dimming the lights, providing hot or cold compresses, and speaking in a quiet tone to ease patients' pain. And most importantly, empathizing with patients, holding space for them to talk about their concerns and fears in regards to their care and pain. These are things that are all relevant to every area of patient care.